Hello, I'm Dr. Dave Myers, Senior Director of Behavioral Health Services at Bryan Medical Center. I'm also a suicidologist, and I've been with Bryan Medical Center for 28 years. I'm extremely proud of the support that Bryan Medical Center has provided over the decades to suicide prevention and to mental health services. And I'm really looking forward to working together with the Lincoln-Lancaster County Health Department and all of the partners that are going to be working together in the future on the grant that has been secured by the Health Department through Department of Health and Human Services through the Maternal, Child, and Health Grant. That's going to be looking at youth suicide prevention in the year to come, and hopefully in the years to come. That's going to be looking at means safety, connectedness, and it's that connectedness that saves lives, and it's our goal to have zero suicide in Lincoln-Lancaster County. Well, 10 years ago when we started HopeLink, the one thing we were really concerned about in our community was the rise in suicides in our youth population here in Lincoln. And we've seen improvement over the years, but we also have seen since the pandemic a rise in the number of attempts across all ages within our community. And so we really need to band together as a community to really look at connectedness and to bring awareness to our community. There's more that needs to be done in terms of means safety, the more in terms of educating all citizens in terms of what to do. We've done more in terms of education, in terms of QPR, question, persuade, and refer. More that we're doing with educating our providers, educating our schools with our Hope Squads, the things that we're doing with, just that kind of front line. What do I do if I run into somebody who is suicidal? And not being afraid and knowing to ask the question, and it's okay to ask the question. We're also doing more with legislation. We worked with the legislature, and we passed LB 923, which was a bill that introduced suicide prevention training for all school personnel across the state of Nebraska. And that bill continued throughout the years, provides training every year so that, we're not targeting, it's targeting school personnel, not saying that they're the only individuals that that have school suicide prevention training, but our youth spend so much time in schools throughout the day. And so we thought, we got to start somewhere, and that's a good place to start, and that has really helped. Helped us pinpoint and really get kids directed to resources.